In 1987, the New York Attorney General arrested Alfredo Bowman and charged him with practicing medicine without a license. They sent undercover agents to his office, all to catch him making medical diagnoses. They thought it would be simple, but it wasn't. More than 70 patients showed up to testify on his behalf. People who said their doctors had given up on them. People who said their diagnosis had changed after following his program. In 1988, the jury acquitted him. The state couldn't prove he practiced medicine as defined by law, and Alfredo walked out of court and kept doing exactly what he had been doing before they arrested him. His name was Dr. Sebi. Alfredo Bowman was born in 1933 in a small village in Honduras. He came to the United States as a young man, dealing with a long list of his own health problems: asthma, diabetes, obesity, impotency. He went to doctors and nothing helped. Eventually, he traveled to Mexico and found an herbalist who, he says, healed him completely. That moment changed everything. He went back to Honduras and started developing what he called the African bioelectric cell food therapy, a plant-based alkaline diet built on the belief that disease can only survive in an acidic body. Get the body alkaline through whole unprocessed foods and herbal compounds. And he said the body would heal itself. He opened a treatment center in Honduras. He started selling supplements and, of course, word spread. Celebrities found him: Lisa Left Eye Lopez, John Travolta, Eddie Murphy, Michael Jackson. By the 1990s, this man was making over $3,000 a day. He had no medical degree, though. He had no formal training, but people didn't care. They came anyway. And here's the part his supporters will tell you. Some of it worked. Not necessarily for the reasons he said, but the foundation of what he was preaching. Cut out processed foods. Stop drinking. Eat whole plants. Take your body seriously. That's not bad advice, y'all. People who followed his program lost weight. They felt better. They reduced inflammation. The results were real for a lot of people, even if the explanation behind them was disputed. The real reason communities trusted him goes deeper than the diet. These were Black communities with documented historical reasons to distrust Western medicine. Tuskegee wasn't ancient history. Over-medication was real. Being dismissed or undertreated in the doctor's office was real. When someone stood up and said the system is failing you, and you have more power over your body than they're telling you, people listened, and you can understand why. The harder part of the story is what he built on top of that trust. He claimed he could cure AIDS, diabetes, cancer, sickle cell anemia, herpes. He made these claims publicly, repeatedly, and charged people accordingly. There were no clinical trials, no peer-reviewed research, no evidence. Perhaps the most consequential thing he said was that HIV does not